I'll have to go back and edit it anyway. All right. We are live on Facebook, and let me just get us recording here as well. Fantastic. Good evening, everybody. Welcome to another ASEA Global Expansion Team Zoom. We have Donnellyn Dominguez joining us tonight because the hot topic on the news is new moms, pregnancy, maternity, and mothers that have just given birth. The death rate is gone up, skyrocketed like 75, 78% in the past couple decades. And here we are in one of the richest countries in the world, and yet we have people dying from childbirth. And so we just wanted to talk about that tonight. And we had nobody better to discuss this with than Donnellyn, because she ran her own birthing center in Texas. So Donnellyn, thanks for joining us tonight.
Thank you, Cindy. I'm so excited to be here.
Yeah. Well, listen, tell us a little bit about what you did before ASEA. I think you sold your birthing center, but just give us a little bit of your background, just so we have context for this discussion.
Okay. I became a midwife 18 years ago, and I did pretty much a home birth practice for the first few years, and then I established a birth center, and I ran that for 10 years. I did find ASEA about 3 years before I retired, and sort of safely experimented with my clients, educated them on Redox, and used it with my pregnancies, and that changed my whole world. But we had beautiful births. The best of the 1,000+ babies that I have delivered were the ones that were on Redox. So of course that was significant to me. And I started doing a lot of statistics as far as, the difference in the ones that were on it and the ones that weren't. But you're right, the maternal death rate is terrible and continuing to go up. I saw one report that said in 2020, it was 23.8 per 100,000. In 1987, it was 7.2.
Yeah, that's crazy.
That's awful.
That's crazy.
You would think it would be getting better, but it's not.
So let's talk about that a little bit. I was talking to somebody, and she was saying, in a perfect world, what I would hope for are women with low risk having their babies at home with a midwife, and then women that are at higher risk having their babies in the hospital under medical supervision. Now, of course, we don't live in a perfect world, and people are going to do whatever they're going to do. But part of the reason why people don't go to the hospital is financial. It's expensive to have a baby, and a lot of people don't have insurance. There's a lot of, extenuating circumstances that I'm sure you have seen a ton of, that we can't even imagine what all goes on out there and why people do, what they do. But when should a woman be in the hospital having a baby, and when should a woman be at home with a midwife?
Well, so much goes into both. Of course, high risk needs to be under a physician's care, period. And midwives should not try to override that and take those girls, because there's a reason they're classified as high risk, and it makes everything a little bit dangerous, even though childbirth is the most natural process. It is not a medical condition. I call my girls clients because they were not patients. They're not sick. Patients are sick people. So I made that very clear the entire time we walked through the process, that they're healthy. This is a natural thing. God created our bodies to have babies, and we can do this. And it's the most rewarding, empowering thing a woman can do, to give birth, especially when she does it naturally, because she thinks if I can do that, I can do anything. And it's true, but it's not as hard as it seems like, and as people perceive it to be, if they are trained properly and know how to relax. Birth is very doable, very doable. But yes, high risk should be in the hospital. My preference would be that all low risk are delivering with well-trained, intelligent, safe midwives. And there's a lot goes in that too. You know, some unfortunately become midwives for maybe the wrong reason. Some are not as committed to the ethics and the high standards that I felt like we did. And some don't have the good collaborative care physicians that I had. I had a doctor who is still my friend, and I could call him about anything. And I would say, this is what's going on. What do you think? And he'd say, you can keep her. She's fine. You know, if things change to this parameter instead of where we are, well, then call me back. But I always knew if he said I could do it, I could do it.
Yeah,
And,
absolutely.
but he would also be there to take one that got out of normal risk range. So that's so important, and everyone doesn't have it. So you've got to interview your midwife well and know that she's got all of her ducks in a row, and you know what her stats are, what her history is, and so on and so forth. The experience is so important in midwifery, because you can have the very best education, but if you haven't delivered a lot of babies, you're not ready to be there by yourself. And I never was. I always had another midwife with me until I was about 8 years in. I had another midwife with more experience than me. And then I just had another midwife, we actually had a neonatal NICU nurse that came to every birth, so that if there was an issue with the baby, she was there, and she was trained in the hospital. So anyway, there's just so many variables, but healthy moms can very well do birth out of hospital. If they've got a good midwife watching them, so that if things get out of order, she'll transfer care. High risk should always be in the hospitals, period.
Right.
And it's just the safest way.
So we went down to Ecuador on the ASEA Advancing Life mission, where we were building the vocational schools in the mountains of Ecuador. And we would see where these people had these babies in their homes, way away from a hospital, and they'd have lots of them just on these dirt floors. And I mean, it was unbelievable. And so I love what you say about, you know, childbirth is not a sickness. It is it's a natural thing, part of living, right? I mean, I've given birth to 2 children, 2 babies, and I certainly didn't know what I was doing. I had never done it before. So I really appreciated all the guidance that people got. And of course, I read books before I did it and all that kind of stuff. But, it's nice to be with a trained professional who can kind of give you some vision into what's going to happen in the next couple hours, or, from now until you have your baby, right?
Right. I did a video after, sounds like I'm advertising, I'm not, but I did basically a childbirth class after I retired to put online, because I thought I really loved teaching moms what to do and how to do this, how to relax, how to exercise, how to eat, the amount of water they should be drinking, all the basics. So I put all of that on an online course so that I could point them to it, even though I'm not practicing anymore. But being prepared is very important. Now, those ladies in Ecuador are a whole different ball game, and the risk is higher there because they don't have the kind of care that we have here. Our stats should be so much lower. Some of them are not. Some of the third world countries do better than we do. But those women expect to have that baby. They don't expect things to go wrong. They don't expect to have an epidural, the first contraction. You know, a lot of what happens and goes wrong is because of medical intervention, because these girls don't want to feel anything. So it can be a negative chain reaction when they have procedures done before they should be, you know, or if maybe their doctor, and I love doctors, don't get me wrong, but if he is wanting them to go ahead and be induced because it's Christmas time, you know, or a vacation is planned, he may not say that, some of them do, but or usually what you hear is, this baby's getting really big, we probably ought to go ahead and induce you, you know. And then if the dates are off by 2 weeks, they could end up having a preemie. And then there's more risk for the baby. And so anyway, there's a lot involved, but birth should be a normal procedure. Girls need to be healthy. A lot of them aren't. And I lectured nutrition all the time. They had to keep diet diaries. I was the mean old midwife. I made them keep diet diaries. We talked about exercise. We talked about water every appointment. But we had beautiful babies and lots of them.
So let's talk about that. You said that when you were introduced to Redox and you got some of these pregnant women on Redox before they had their baby, and it changed your world. Give us a little insight into what you saw, what you noticed with these pregnant mommies.
I practiced informed consent. So I educated them about everything, vaccination process, you know, how to diaper the baby. I educated about everything, the supplements that I used, and I educated about Redox, and about 25% of the girls on my books got on it. And they were 100%. I want that. I want to have the healthiest baby I can. So I monitored closely because I was kind of holding my breath. I knew I was going out on a limb, but I also am the healthcare provider. So I wasn't doing anything against rules. And it was amazing. You can always anticipate that there's a possibility of a mom developing a pregnancy issue or challenge, because the body is definitely compromised during pregnancy. But with these moms, there were none. I mean, literally the most beautiful pregnancies. I had a few that were not on it, and they developed some of those conditions, and I put them on it and it corrected itself. So that was very interesting. And then the births were phenomenal. They would birth faster. They would have fewer of the issues that can happen at birth that are a challenge to mom and midwife. I always say I need a girls only Zoom to really go into that, but their tissue integrity was better. They delivered faster, easier. I would always give them 2 ounces every hour or every other hour during labor. And I used the gel when I checked their cervix. So that got their cervix behaving the way it's designed to. And I mean, we had great births. They were phenomenal. And then the postpartum was probably my favorite, because none of them, this is a hormone leveler. None of them had the roller coaster after the baby was born. So one of the last ones I delivered last year was a set of twins, and they were baby number 8 and 9 for this mama. And if anyone deserved to have postpartum issues, she did. But she didn't have anything. She started on Redox when she was 12 weeks. She had a perfect pregnancy. She had a phenomenal birth. At 41 weeks, she carried those babies over full term.
Wow.
And they were born in like 3 hours, 4 hours. Perfect. Just perfect. And almost no blood loss, which is phenomenal for twins. I mean, so little that I was shocked. And so, it's just many, many stories like that. I think it should be a requirement for every pregnant woman in the world to be on Redox.
Yeah, I get you. I get you. Now, the label of the bottle has to say, please do not, pregnant, don't take it if you're pregnant. And if you're nursing, consult your doctor. And of course, we have to put that on the bottle,
Right.
just as a regulatory, precaution. But because C is native to the body, the pregnant mama is already making these molecules, and so is her unborn baby. So the most, it's not like adding something to the body that's not already there that could cause probably contraindications or some kind of side effect. This is native to the body. It's safer than swallowing your own spit, right?
Exactly. I mean, it's safer than water. It really is. You can overdose on water. You can't overdose on something your body creates. And that's what occurred to me after I got my health pack, is what else do I have on my shelf that's 100% non-toxic and helps the body with its biointelligence know where to send these healthy molecules, these signaling molecules, to detect, protect, repair, replace cells that aren't working right. I don't even have to know what's going on.
Right.
So that is a gift, because any practitioner, regardless of how good they are, they go by the labs, the sonograms, the whatever tests they have, but it's still a little bit of a guessing game. And that's why so many people out there say the doctors can't figure out what's wrong with me.
Yeah.
But your body knows and corrects things in priority order. So it was an amazing gift, and I loved watching it work. In fact, now I'll just say this while we're on here, all the pregnant girls that I know who are taking the product, I ask them when they're completely through, get me your records, your pregnancy, your labs, your delivery, and your postpartum. Take your name off of it and mail it to me, because I'm continuing to collect evidence about how good this is and how powerful it is. I think that could help maybe someday. I understand that we have to have that on the label. I tell girls, check with your doctor. Tell him what this is. If you're afraid to, take someone in your upline that understands how it works and explain it to him. I practiced informed consent. I wanted my girls to do what they were educated about and wanted for their bodies. I didn't think it was my place to say, you can do this, you can't do that, as long as it was safe, But I recommend that people do that.
Now, what did you mentioned something, you said when I got healthy. So did you have some health problems as a midwife? Were you dealing with some different things yourself while you were helping these mamas?
Yes, I had a significant health challenge in 2015. I had surgery. We thought everything was fine, but it came back in 2016, and the medical regimen that I was put through almost killed me. Thank goodness it didn't. When I survived it, the doctor said, we won't give you the fourth treatment because that would kill you, but we've got to give you one of these two medications every month for the rest of your life. And I said, well, I don't know how crazy you think I am, but you just nearly killed me. I'm not doing any more of your medicine. I'll find something natural. And I looked for 20 months. 16 months, I guess. So long and so discouraging, because I did everything out there, spent another $20,000, and nothing helped. Nothing made me feel better one day. And I was sick. I was really sick. My prognosis for living was fair. And but I continued to work, because you know how that goes. If you own the business, you don't take off sick leave. So I continued to work and struggle and hire people to help me and hold on to the walls to get from one room to the other, go to bed at 6 p.m., get up and do my day again, cry when I had to get up for a birth. It was a very dark time. But when I found Redox and added that missing link to all of the good things I had been doing for 16 months, all the cells turned on and my body went, wow, this is what we needed. And I began to get my health back. And it was miraculously fast compared to some, but I know I had been working at it for so long, like over a year. And so I think that's why my body responded well. And it was a miracle. It was a miracle to me, and it was a miracle to everybody I was taking care of. I hadn't told my girls, my clients, my condition because I didn't want them to leave. I had one that found out, and she changed healthcare providers because she said she was afraid that I would die and not be able to deliver her babies. So I'm not telling anybody else.
Right.
So, but it was, everybody saw the difference in me because I felt good again. I had energy again. And I was so grateful. I was grabbing people to tell them my miracle. And because of that, some people would just say, I want to feel as good as you do. What are you doing?
Right.
And then I would introduce Redox, and they'd try it and they'd get good results. And you know how that goes.
Right. Right. Well, they say that, ASEA is not the only thing you have to do to build good health in your body, but everything that you do that you're doing that's good for you is going to be amplified when you add Redox. And that's why I think you responded so quickly, as you already had all the materials. You were just missing the labor. So when you added the labor to tell the materials where to go, poof, things started to happen.
Exactly. It was like there was a blackout in that particular area, and the Redox flipped the switch on, and my body went, oh, I get it. This is what we need to do. And so my results seem fast. I tell people, don't use my testimony and set people up to expect to get results in 3 or 4 weeks. It doesn't always happen that way. But I had been eating organic, doing all of these natural treatments, taking so many supplements. But like Alan says, when your cells aren't signaling, nothing else matters.
So true.
When I add the cell signaling, then it was great.
Yeah, absolutely. Now so you sold your birthing practice, right? You're not running that anymore, right?
No, I sold at the end of 2020. I had been in ASEA for 3 years. And so I've been doing Redox full time for 2.5.
Okay.
I've delivered another 12 babies or so since then, but they were just my pets or whatever.
You're so funny.
I couldn't say no.
Yeah, that's right. So now I know a lot of the complications happen because people are asking for C-sections when they don't need a C-section. A C-section was originally designed for people who were in trouble and their baby was not going to be delivered vaginally. And so they had to have a emergency C-section because something went wrong. And all of a sudden it became a convenience factor because the person wanted to have it on their birthday, or they wanted to have it on this specific day, or they were going, like you said, on vacation, or they had a ski trip or whatever. So all of a sudden people are getting unnecessary surgery to deliver a baby. It's not as healthy for the mother and it's not as healthy for the baby, right? And it can also cause complications. So when we're talking about these, the mortality rate going up, for crying out loud, if you have an unnecessary surgery, stuff can happen, right?
Yes. Surgery is so much harder to recover from than birth. Again, birth's a natural process. Your body knows how to do it and you get well. But C-sections used to be 3 to 7% of births. And recently it's up as high as 65+% of girls choose that, or their doctors choose it, or, whatever. But yes, the rate is way too high, and it automatically sets up other issues that can and do often happen. Also, inductions. There's no reason to be induced. Normal pregnancy is 38 to 42 weeks. But boy, when you hit 40 weeks, a lot of doctors are like, okay, got to get that baby out. Some moms just have longer gestation I've had moms that their moms, their aunts, everybody carries that baby. I say they just have to cook longer. They carried 41, 42 weeks. And there are a few more risks after, after 40 weeks. The percentage does go up for complications, but you just watch them like a hawk, and let their body do it, because when their body goes into labor naturally, it happens so much easier than when it's forced. I always tell mom, have you ever tried to make guacamole out of an avocado that's not ripe?
Yeah.
Well,
Yeah.
when your cervix is not ready to dilate, it's like that avocado.
Mm.
And you can slam it with contractions over and over again, usually, induced contractions. And all it does is wear out your body, wear out the baby. Eventually there will be challenges, and now we got to save the baby. Heart rate is wrong. Things are going south. So I like to let moms carry those babies until they get to the date that God gave them to be delivered.
Right. That's right. Well, and the other thing is that we don't necessarily get the dates right. I mean, it's
Oh.
not a perfect science. I know that, the doctor, when he anticipated the night that I got pregnant, I was out with a girlfriend. So that's not when it happened. So, it's just not a perfect science, is it?
No, it's not. The early sonograms are the most accurate, but a lot of girls don't have a sonogram between 8 and 12 weeks, which is the one that's the best for dating.
Yeah.
If you have your first sonogram at 20 to 22 weeks, which is when I usually did my first sono on my girls, it can be off as much as 2 weeks,
Right.
And the further along they get, the further off the sonos are.
I bet. Well, I know that I had been measuring big the whole time. And then the doctors met my husband, Bo, who's 6'8", 285 pounds. And the doctor was so freaked out. He brought in his partner to deliver this after I'd pushed like crazy. I saw the ladies in the grocery store. They'd had the babies and I couldn't have the baby. They decided to give me a C-section. They brought in another doctor and they said to the whole staff, this baby's going to easily be 15 pounds.
Oh,
And I
my
was
God.
like, oh my gosh. Well, little Dylan was born 7 pounds, 13 ounces. They were wrong, so
Wrong.
they just don't know everything. So obviously, Donnellyn, our whole objective here is to, with ASEA, with Redox, with education, with communication, with compassion, we want to prevent mortality. We want to prevent complications. We want to make sure that the mama's healthy, that she's taking responsibility for her health while she's pregnant, and that the baby's healthy when the mama has the baby. So are there any, and we're almost to the bottom of the half hour, but give us just some basic things. I know you've mentioned nutrition and hydration and, and doing it following God's natural course of having a baby, as opposed to a man-made, way of having the baby. But what are some tips that you can give the people that might be listening who either know somebody who's pregnant, or maybe they're pregnant, or maybe they're thinking of when they were pregnant, or even when their mom was pregnant,
Well, if they're on this call, then they're probably familiar with ASEA. And redox signaling molecules did amazing things for my moms during their labors. During their pregnancies, their labors, and their deliveries, and their postpartum. So that would be probably my first recommendation. But do it properly. Go to your doctor, help him understand, get his permission, or tell him that you want informed consent. And then also, be picky when you are picking out your healthcare provider. Interview people. Even the doctors can be interviewed. Just because he delivered your mom and your sister and all your little brothers and sisters does not mean that he's the right healthcare provider for you. So interview whoever you do, whether it's a doctor or a midwife, and make sure that their values line up with yours. That's super important. You need to feel comfortable. You need somebody that will spend more than 2 minutes an appointment with you. and get to know you and what you want. And then, I recommend that you educate yourself, read books. I've got Active Birth, Kinsey Gore's A Thinking Woman's Guide to a Better Birth, Silent Knife. This is kind of a good one to read, and just educate yourself, and reach out to a midwife, talk to them. You can look at my my little birth video, my childbirth class video if you want to. It's healthybirthbasics.com. It's not expensive. I made it so anybody can afford it, and they have it for 10 months so they can actually exercise with the video every day if they don't really know what to do, and be safe. I don't want girls out there lifting weights, 300-pound weights off the ground. That's not good.
Yeah, right.
I've seen them do it, and they're like, yeah, look at me work out. Well, your pelvic floor is going to be on the floor before you ever get the baby out. So don't do that. But just really educate yourself, I think. Don't be closed off to any of the good things that your body can do naturally. And don't be afraid of labor.
Yeah, don't be
So
afraid.
many people do it because they don't want to feel anything. That's not even healthy. Feel it all and embrace it, because
because at the end of the pain, you actually have a baby. It's not just you go through pain and then you survive. You actually, you're having pain for a reason. In fact, when I had my first child, he was delivered by C-section because he was sideways. Then I had a VBAC with my second child.
Yay.
And I read a book in between my first child and my second child that was called Mind Over Labor that I would definitely recommend. And what it got me, it was just a little tiny book, but it taught me why I was having the pain and why I was feeling what I was feeling, and that the baby and I were both going through something together. And when we worked together and accomplished this goal of this baby being delivered, then we were going to have each other, so it was a mindset thing that really helped me go through the whole labor process. And it was fantastic. So
it's actually, even physically, all of the endorphins that you release in that having a contraction and then relaxing, and having a contraction and then relaxing, all of those endorphins actually help you bond with your baby. There have been a lot of moms that, if they just have an epidural and lay there and watch TV and then there's the baby, oh, okay.
Yeah.
The bonding really is enhanced by the process. It's kind of like, there's a parallel to this business. If you were just handed triple diamond and you never worked for it, would you really appreciate it?
Right.
No. So that accomplishment is the greatest accomplishment a woman can ever do. And I'm not shaming anybody that doesn't do it or doesn't want to, but it is worth the effort. So I just encourage moms to have the babies the way God intended for you to.
Yeah, we took it one step further, and we didn't find out the sex of the baby. That was the one time when Bo had control. So he would make the first announcement, it's a boy, it's a girl, and
that is what my clients did. And it's so much fun. Yeah, it's so much fun.
So exciting. Yeah. Well, Donnellyn, thank you so much. I really learned a lot. I know that there's some people that want the names of the books, and you can go back and listen to this again. You can fast forward to that portion where Donnellyn is talking about the books that she recommends. But anyway, I just want to thank you, Donnellyn, for taking some time and really talking about this really important subject. And hopefully we can help more moms be healthy, more babies be healthy, and less moms have childbirth mortality. It's insane that happens. And I love the fact that you said Redox not only helps with the pregnancy and the birth, but also the postpartum, because I had postpartum depression with my second pregnancy, and it's awful. It's just awful.
I had it with my second too. I felt like Donnellyn moved out and this crazy person moved in, and I didn't know if I'd ever come back,
Yeah.
But you can miss all that with the best hormone leveler, and the husbands love it when you miss all that.
Yes, they will. Yes, they will. Well, and the baby's happier too, because you're not so stressed, and so you can take better care of the baby. Yeah.
Yeah, that has everything to do with the baby nursing well and all of the things, sleeping better, because they really pick up on what you're feeling. I'll type the names of some of these books in the ASEA United comments
Okay.
when we're all through, so that
Okay.
people can, because there's more than this that I would love to recommend.
That'd be fantastic. All right. Good night, everybody. And Donnellyn, thank you so much.
Thank you, Cindy. This was such fun. Talk to you later.
Okay. Good night, everybody.